All right, let's move on to the clavicle itself when we talked about this area. There's all sorts of weird questions. What percentage of clavicle are the medial third, the intermediate third, and the lateral third? Which one is more likely to be fractured? I really don't care right now. It's irrelevant to this discussion. You can look it up. It's usually a question that you see in a test. All I'm really concerned about is that you recognize a fracture and again palpate from medial to lateral and palpate the entire length along the clavicle. Sometimes you'll feel the step off, sometimes you won't. You'll frequently see something that looks like this on x-ray. Sometimes it's more subtle. Fractures that are displaced almost invariably end up with the proximal or the medial segment going up and the lateral segment going down. It has to do with the forces involved in most of the injuries. Don't even really worry about that right now. All right, and my favorite, which is to see really bad clavicle fractures, because in medicine we go looking for bad things. Let's make that red because it'll just be easier. There's always some sort of fascinoma, and basically the more gross the pathology or the more horrific and traumatic it is, everyone likes to look at it. So anyway, let's talk about this for a sec. So we're talking about the area over here under the clavicle. Again, nerves, arteries, and veins, lions and tigers and bears, oh my. Fractures of the middle third of the clavicle tend not to cause as much injury to the neurovascular structures and bundles, and the reason is there's actually more volume underneath there. Let's do that. There's more volume in the area under the medial third of the clavicle. Nonetheless, you must document a normal neurovascular exam downstream of the clavicular fracture. Do that each and every time.